Welcome to Wisteria Home Care Agency's training module on HIPAA and infection control. Today, we will explore the essential components of the Health Insurance Portability and Accountability Act, or HIPAA, as they relate to patient privacy. We'll also dive into our agency's policies and procedures for effective infection control. The purpose of this learning module is to furnish our team with an understanding of HIPAA requirements, specifically concerning patient privacy. Established in 1996, HIPAA not only focuses on safeguarding health information, but also enhances access to health coverage and reduces administrative costs. Upon completion of this module, you will be able to 1. Explain the components of HIPAA legislation. 2. Understand how HIPAA expands healthcare coverage availability. 3. Identify who is affected by privacy and confidentiality mandates. 4. Describe what constitutes protected health information, or PHI, and individually identifiable health information, or IUI. 5. Implement processes to assure patient information is kept confidential and secure. And 6. Understand HIPAA's role in informed consent and the use of patient data in research. HIPAA was passed with phenomenal bipartisan support and includes pivotal measures aimed at both improving patient care quality and restoring public trust in the healthcare system. While many focus on the privacy and confidentiality aspects, it is essential to note that HIPAA also involves provisions related to employers, insurance coverage, and other stakeholders in healthcare. Provisions and implications. HIPAA prohibits insurance companies from denying coverage based on pre-existing conditions, family health status, and other factors. It established a pilot program for medical savings accounts and improved tax breaks for long-term care insurance. The investment in HIPAA compliance is significant, but the potential benefits in public confidence and care efficiency are invaluable. The basics of HIPAA. To protect patient information, HIPAA comprises both privacy and security provisions. Compliance was required by 2003 for most health plans. However, if state laws are stricter than HIPAA, those regulations must be adhered to. Why is HIPAA needed? Health professionals recognize the heightened need for confidentiality in patient records, especially with the proliferation of electronic health records. Past incidents of data breaches have underscored the importance of HIPAA's role in eradicating unauthorized access to sensitive information. HIPAA's provisions apply to covered entities, including healthcare providers, health plans, and business associates. At Wisteria Home Care Agency, as caregivers, you are included in these definitions, and compliance is not optional. PHI covers all forms of information related to a patient's health, including electronic paper or oral communication. Additionally, TUHI is any information that could potentially identify an individual. Knowledge of what constitutes PHI and IEHI is paramount in maintaining compliance. Patients must provide informed consent at their first encounter with Wisteria Home Care. This consent should explicitly outline how their information will be used. It's imperative we have patient authorizations in place when using their information for any purposes beyond immediate treatment. Every patient has rights regarding their health information. This includes the right to privacy notices, request restrictions, and access their PHI. It's the responsibility of each employee to ensure these rights are upheld. In our home care setting, maintaining patient confidentiality is critical. This includes how we manage sign-in sheets and communicate with others regarding a patient's location and condition. Always prioritize confidentiality. Now let's shift gears to infection control within Wisteria Home Care Agency. Our objective is to minimize infection risks for both clients and staff. Proper hand hygiene, use of personal protective equipment, and intentional cleaning practices are vital. Thorough hand hygiene is essential. Use antimicrobial soap and wash hands for a minimum of 20 seconds in the following situations: before and after client interactions, after using the restroom, and before handling food. Remember, if soap and water aren't available, use an alcohol-based sanitizer. A slide transition: safe practices in client homes. Ensure that bags carrying equipment are used according to our guidelines. Never place your bag on the floor, and always maintain cleanliness within. Double bag supplies as necessary when caring for clients with known infections. Slide transition: infection prevention. Every employee plays a role in our infection control program. Understanding disease transmission categories, including airborne, bloodborne, contact, and droplet, is vital for safe interactions in the home care setting. Slide transition conclusion. Thank you for your attention today. Our commitment to HIPAA compliance and infection control is integral in providing high-quality care at Wisteria Home Care Agency. By understanding and implementing these guidelines, we ensure the trust and safety of our clients. For any questions, please reach out to your supervisor. Final slide: Wisteria Home Care Agency contact information. Together, let's make a meaningful difference in the lives of those we serve.